Radiation oncology is a medical specialty that involves the controlled use of radiation to treat cancer. Radiation therapy, or radiotherapy as it's otherwise known, is the actual treatment delivered by the radiation oncology team. The radiation oncology team includes a radiation oncologist who is a medical doctor who has done specialist training in the management of cancer and the use of radiation treatment. The team also includes radiation therapists who are allied health professionals who actually deliver the treatment from day to day and help the radiation oncologist to design the radiation treatment plan. The team also includes medical physicists, radiation oncology nurses, and other allied health professionals who all work together to care for patients with cancer. There are different types of radiation therapy, but for patients with bladder cancer, we're generally talking about something called external beam radiation therapy, and that's where high energy X-rays are targeted at the cancer from outside the patient's body. Modern radiation therapy is very carefully planned and delivered, and the technology has progressed a lot in recent years so that we're more accurately able to target the cancer whilst sparing the surrounding normal tissues with more and more accuracy. Radiation therapy works by destroying or inactivating cancer cells, and it does that by damaging their DNA. Normal cells are also affected by radiation treatment, and that's why there are some side effects. However, normal cells are better at repairing themselves than cancer cells are, and that's also why we generally split the course of treatment into lots of little pieces, and that allows your normal tissue time to recover in between treatments. People often ask how radiation therapy differs from chemotherapy or immunotherapy. Chemotherapy and immunotherapy are both types of drug treatment, and the drug travels throughout the body through the bloodstream and affects all the cells in the body. Radiation therapy is a targeted treatment, and it only affects the cells in the sites where it is aimed. Radiation therapy is usually delivered as a course of treatment given Monday to Friday with a break on weekends. Treatment is generally given once per day. Courses of treatment aiming to cure the bladder cancer are generally given over 4 to 6 weeks for patients with localised disease. Treatment for patients with more advanced disease or disease which have spread, where the aim is for symptom control, tend to be much shorter, and that might be a single treatment or 1 to 2 weeks of treatment. When a patient is referred for radiation therapy, the first step is to meet with the radiation oncologist who will assess whether radiation treatment is suitable for that person. They'll also explain the logistics and the side effects of treatment, and we'll come up with a treatment plan in conjunction with the patient and their wishes. The next step is to have a design session, sometimes called a simulation session, and that's where a patient will be positioned on the treatment bed using some equipment to keep them nice and still, but also nice and comfortable during treatment, and it's tailored to their body shape. Patients are sometimes asked to either fill their bladder or empty their bladder before getting onto the bed. And sometimes patients will be asked to have some small permanent marks left on the skin to help put them back into that same position when they return for treatment. Measurements and scans are taken of the person in that position, and then they go home and the radiation team works on designing their plan behind the scenes. And that may take up to 1 or 2 weeks behind the scenes, making sure that we target the radiation treatment to where the cancer is, whilst trying to limit the radiation dose to all the normal tissues that are close by. When a patient returns for treatment to start, it's generally given as an outpatient unless the patient is very unwell and needing to be in hospital. But generally people come back and forth from home each day, Monday to Friday, with a break on weekends. The treatment itself only takes a few minutes, but the patient might be in the department for 15 to 20 minutes, And most of that time is spent getting the patient into the right position and making sure that they're comfortable on the bed. When the treatment is happening, they lie nice and still, and the machine will move around them and might make some clicking noises when the radiation beam is turned on, and that will take just a few minutes. The patient doesn't see or feel the radiation while it's happening, although some people will say that they experience some warm sensation in the body part that's being treated. After the treatment, they're not radioactive in any way, so they're free to be around other people. Many patients still drive themselves to and from treatment, and some patients continue to work during treatment also. We encourage patients to eat their normal diet and go about their normal daily activities as much as they feel comfortable to. Occasionally, patients who are troubled by diarrhea may be asked to go on a low fibre diet or given some medications to help with those side effects. Sometimes we ask patients to stop taking some high-dose vitamin supplements during treatment if they have the potential to increase or decrease the effectiveness of the radiation treatment. And we would review patients' medications to make sure that there's nothing that's going to interact with the radiation treatment. One thing that patients can do to help take control of their risk of getting side effects is if they do currently smoke, we encourage people and assist people with stopping smoking because we know that smoking increases people's risk of developing side effects and actually reduces their chances of the radiation being effective. We encourage people to continue gentle daily exercise if they're used to doing so, and basically to listen to their bodies, rest as they need to, and continue a balanced diet. And many patients actually continue to work during treatment and continue to drive themselves to and from treatment as well. There's no need to isolate from other family members or other people because at no stage is the patient themselves radioactive. So most patients are seeing a urologist when they're diagnosed with bladder cancer, and a urologist would often make a referral to a radiation oncologist to give them a second opinion about that alternative treatment option of having radiotherapy if they are suitable for that. If patients are not offered that referral, I'd encourage them to ask their urologist if they are actually suitable for that as an option and ask if they can have that opinion. There may be a reason why the urologist has or hasn't made that suggestion. We're always happy to give an opinion either way, and we would be happy for patients to be referred by their urologist or by their general practitioner or even by their medical oncologist as pathways to get to see a radiation oncologist. In public hospitals, there's usually no out-of-pocket expense for patients to have radiation therapy. Radiation therapy is also available in some private centres, and they have quite variable billing practices. And usually it's possible to phone those centres to get an idea of their out-of-pocket costs if there are going to be any.